Okay, Anuradha ma'am, you can please unmute yourself and ask your question, please. Anuradha ma'am. Kavita ma'am, if you want, you can ask your question. Please unmute yourself.
Hello. Hello.
Yes, Anuradha ma'am, you're audible.
Yeah. Sir, this is regarding, I want to ask a question regarding my husband. Actually, I am a rheumatoid from past 10 years. So I want to take this treatment now. This is regarding my husband. From past 1.5 months or 2 months, in his nose, he is getting a foul smell. So anything, any cooked item or anything, whichever is having a pleasant smell also, once it comes to his nose, he's getting a foul smell. Then he is not able to eat anything. What doctors said is this may be after COVID effect. And they gave some medicine which has not helped him at all. So what should be done for this?
See, foul smell can happen because of few things. I'll say, I'll describe it. One thing is, if there is a hypothalamic inflammation, your nose is directly related to your brain. If you get into any kind of a nerve issue, especially if there is a hypothalamic inflammation, it may happen. The second part is if because of the nerve issue, and as I said, COVID impacts the lung and the nervous system. The second factor is nervous system. So if the nervous system of the body gets into an impact, and especially the upper region of the body, then what may happen? Your nose may develop some kind of polyps inside, or it's a reaction to a weak nervous system, or it's a reaction to COVID, and that may cause foul smell. Right? There can be other factors which I can't talk about on a public platform, because then we are talking absolute logic here, and we have become a little more less intelligent species because subtle aspects of life. If I start talking about, people say it's kind of a tantric thing. There can be other things also. Now, can it be handled? We have cases of nasal polyps, or people having even see breathing issues, sleep apnea, people into sleep apnea, and people into hypothalamic inflammation who came out of their issues. Now, unless and until we diagnose it, we will never be able to know what is the exact cause of the problem, right? So only if we diagnose, we can say, okay, in this person, this is the problem, and we can actually go towards correcting it. He will certainly get help. He will easily be able to come out of this issue, but he'll have to work upon his system. This is one thing. The second part I also wanted to talk about is, when you say autoimmune disorder, right? Rheumatoid arthritis, when you say autoimmune disorder is not something which comes in and never goes. Morning, your immune system might be a little like hyperactive. In the evening, when you are fine, your immune system comes down to normal. So how to maintain the normal condition of the body? This is what you have to do or learn. Only when you maintain a normal condition of your system, your autoimmune disorder will actually vanish. It is not something which cannot go off, but it will never go off with medication. It will only increase. Medication is like poison for the body. The more poison you give your body, the more risk the body will get into. And because of that, we are getting into autoimmune disorders of several kinds, leading to the end stage, which is cancer. right? So you can come out of your rheumatoid arthritis condition. You can take a little support of some natural things also, some Ayurvedic stuffs also, but working upon the body, there is no alternative to it. There is no choice apart from this. This is something which is compulsory.